Travis here at Par 4 Fitness. I am joined by Elsa Clark, live from Bradenton. We'll be talking about plyometrics today. So, as you know, Elsa's going through her certified strength and conditioning specialist certification, and she's going through the books, and she's going to do a little presentation on plyometrics. I'll chime in a little bit throughout the session here as well. So just let me pull up my screen here. And we'll go to slideshow. All right, take it away, Elsa.
So in our perform section, we do a lot of plyometrics. And it's more of this presentation is more of just the reason why we do plyometrics, how they're important to the golf swing. But a plyometric is defined as activities that enable a muscle to reach maximum force in the shortest time possible. So if you think about the golf swing, I don't know how much it is off the top of my head, but it has to be like 1.5, 1.7 seconds. Am I in the right ballpark?
Less than that. What do you find there, Droid? We're about 1.3
for the
full swing.
About 1.3.
1.3. 1.3 seconds. Maybe
Perfect.
Some are a little longer.
Amateurs tend to be much slower.
Yeah. We're also joined by Andy Scott at the Andy Scott School of Golf. Special guest.
So the golf ball is a really short amount of time. So in order to hit the ball 200, 300 yards, or if you're like Brooks Koepka and you hit it 350 or whatever, you have to generate a lot of power in a really small amount of time. So when used correctly, a plyometric allows us to create that power, to create that force in order to shift our weight from the right side to the left, or if you're a left-handed player, left side to the right. So there are two primary models to explain this increase in power. We have the mechanical model and the neurophysical model. The mechanical model really focuses on the stretch elastic component, and the neurophysical model focuses more on the muscle spindles. And then when we combine them both together, then we have what is on the next slide, which is our stretch shortening cycle. So the stretch shortening cycle is going to combine both of these into three phases. We have our stretch, which is eccentric, our amortization, which is the pause in between, and concentric, which is the shortening. So in phase one, we have the eccentric phase. So we're really preloading against the agonist muscles being used. So an agonist muscle is the primary muscle being used in that specific exercise. So during this time, this is when we store and build up most of the energy. And this is where, like I said, the muscle spindles begin. So that's part of that neurophysical model that we're adding in. And the elastic energy comes from the series elastic component from the mechanical model. So when we combine those two together, then that's what allows for our stretch to happen. It's the primary workforce of a plyometric. So like I said, a plyometric creates that force production. In order to create that force production, we have to have the energy in order to generate it. So if you think about a long jump, then usually if you're watching the Olympics, the person will take step, and then sprint off or jump as far as they can go. So that long jump is going to begin as the feet touch down. So don't think so much as we're actually jumping into it. We're more loading up in that first movement. So as our feet touch the ground, the entire body reaches the bottom of that movement. And then we pause. And when we pause, that's where we lead into the concentric phase. So that is the eccentric phase in general. If you think about the golf swing, so in the golf swing, we have to load up on our right side. So as we're loading up on the right side, we're shifting our weight over. We're trying to keep our weight on that right side, right heel, right foot, and that would be your eccentric phase of the golf swing.
Yeah, exactly. So some things that we see with like K-vests or body tracks, that load, and then we want to see how that player loads and moves concentrically into this next phase.
Exactly. So amortization is going to be the time in between our eccentric and concentric phase. If you think about anything that we do, we build up power in order to shift it to another location. You have to pause, you have to give it time in order to actually shift over. So in this amortization phase, we have a delay where our afferent nerves, which are the nerves that move away, synapse with the alpha motor neurons in the spinal cord. So the timing is key here. If we take too long in this phase, then we're not going to be able to use up that power that's created, and it's eventually going to be lost. It's not going to be used by the body. So if you think about it in the golf swing, we're loading up, we have to pause in order to shift over to the other side. But if we don't actually pause and we're just swinging wildly at it, then that energy is just going to be lost. It's going to be lost somewhere down here, and it's not actually going to be moved over. So a lot of times if players are decelerating, then that energy is lost. They take so far back, they don't pause, and they just swing immediately through as fast as they can, and we're not actually transferring any power, we're just wasting energy. So that's a primary example there.
Yeah, and I think a great example would be like Hideki Matsuyama, who's got a longer transition period from backswing to downswing than most. But if you look at him on super slow motion, he's actually still moving the entire time. It just looks like he's just frozen still at the top of the swing, but he's actually still slowly pulling apart those muscle fibers and creating more of that eccentric phase, getting into this amortization phase, and then he's firing really quickly down. That's why he creates a lot of speed.
So our third phase is the concentric phase. So if we don't have the energy that's stored up from the eccentric phase, then we're not going to be able to get here. So that's why the eccentric phase is the first phase. It's so important in storing that energy, building that energy, pausing for as ample time as you need in amortization phase in order to actually use that energy in the golf swing. So, if you're taking it back, we've got eccentric, amortization, we're loading up, concentric, we're driving through, taking that energy and increasing the movement, increasing the force production out towards our target.
Good. So if you're taking a lesson, you're working on some backswing motions, say, well, I'm just going to navigate all the way around that. I'm just going to start from the top. You don't get that eccentric phase. You don't get that stretching that you would with taking a backswing. That's why the backswing motions are so important.
Exactly. So in our Perform program, there's multiple variables. Obviously, we're not working with each of you individually, so we can't really go through this and focus on, okay, well, Bob needs these requirements, and Jeff needs these requirements, and Alex needs these requirements. So we're really just taking our primary population that is tuning in with us and who is watching it, and we're organizing our Perform program based upon these different factors.
Right, and if you're in studio, then that's something that we would look at there individually or a small group setting. Say, okay, these athletes perform pretty standardly across the board. There may be some modification from one to the next, but virtually is a little bit more challenging. So that's some of the obstacles that we're coming across right now.
Right. So a needs analysis is this first step. In this, we're pretty much understanding the athlete, who they are. We're looking at their medical history. We're giving them a PAR-Q, which is a physical activity readiness questionnaire. We're seeing how ready they are in order to play their sport. So if you're a strength and conditioning coach, so let's say FGCU, for example, my coach doesn't just work with golf. My coach works with cross country. He works with baseball. He works with softball. He works with basketball, all different kinds of athletes. We have over 300 different athletes, and all of us are doing different motions with our body. So he has to be able to select the sport. And in some cases, he has to be able to go specifically to certain positions. Basketball, we have a center, we have a guard. Softball, we're going to have a shortstop, we're going to have third base. So it just depends on the kind of position. In our case, we're only working with golf, and we don't have an offensive or a defensive team in golf. It's just you and the golf course. So in other situations, coaches have to focus on the type of sport and the position. But for golf, then we're really just focused on, okay, how do we reduce injury? How do we maintain safe, effective training that allows our clients in order to produce the best force production in order to hit the ball as far as they're capable of hitting it. So although we have all these differences among different sports, our main goal is to design a safe and effective training program for all of our athletes. So there's different kinds of modes that we can use when we're doing perform. Some of these we've done, some of them we haven't, but it reflects back to, if you watched our series last week, we talked about push-pull exercises. So it's very important to alternate. We want to alternate our pushing, we'll alternate our pulling, alternate lower body, upper body. So if you want to do extra exercises at home, then these are some really great plyometric exercises that we can do. We've done depth jumps. We actually did them today. So they're the jumps where we land here. So those are really working the lower body. Squat jumps, we're squatting down, jumping up. Vertical jumps as if you were using a jump rope. And then if we go into upper body, if you have a medicine ball and you're throwing it against the wall, you're really using that core to rotate, just like we would in a golf swing. Baseball pitchings, upper body, push-ups, upper body. And then if we're focusing on the abdominals, then we're really going to work on our sit-ups, our medicine ball slams. So we're taking the medicine ball overhead, slamming it down on the floor. Plank up-downs, we're in a plank and we're going from the plank to the push-up position, 1, 1, 2, 2, back down. So these are just different plyometrics that are really effective in working different body regions, and in order to alternate that push-pull and lower body, upper body.
Yeah, this is always something that, say you have an athlete that's injured, maybe their shoulder's bothering them, they can still make advances in training, strength-wise, but also even into plyometrics. If you can do it safely and you can program it according to what they're dealing with, then you can still be effective in gaining lower body activity while they're going through the injury rehab.
Exactly, yep. So intensity, in the book that I am studying for this examination, then we focus on different kinds of ways that we can increase and measure intensity. So if we're doing, if we're focusing on points of contact, then the use of single leg lower body plyometrics increases the stress compared to double. So if you think about it, if we're jumping from right side to left side and I'm going on 2 feet, I'm really not putting that much stress on my body as I would, you know, if I were jumping from 2 feet to 1 foot. So it just depends on that different component there. So 2 feet, we're taking all of the stress of the body. 1 foot, we're taking all of the stress of the body on half of the base that we had before. So that's a way of increasing intensity. If we increase the speed of the drill, so if we were to take our 5-yard shuffle exercise and we were to say, okay, you have to go down and back in 10 seconds. And the next time, okay, you have to go down and back in 9, down and back in 8. That would be a way that we could really effectively increase the speed. Height of the drill, the higher the body center of gravity, the greater the force of landing. So there's actually a couple rules when it comes to this. Most coaches tend to do a 12 to 36 inch box. So if you had a black box, I don't know if any of you have seen them before, but they're typically 36. You can add height to them, but that's how you do box jumps. And you can also do depth jumps like we do here, but you're jumping off of the box onto a flat surface. Now, they say that if you're over 200 pounds, then you should really, the max jump that you should do in order to avoid injury is 18 inches. So that's just something that we can do there in order to increase the intensity. If you're over 200 pounds, you know, maybe start with 6 inches, go up to 12, go up to 18. And then body weight, we can increase the level of intensity by the greater the athlete's body weight, the more stress is placed on the body. So, you know, if we're doing those squat jumps, we're landing, and I'm going to place less on my body compared to a 200-pound lifter, just because my body weight is significantly less than that.
Right. So one thing that I've experienced in some seminars is with jumping. There's a outfit out of California. They do a lot of testing with NBA combine athletes. So they're looking at 3-dimensionally how do they perform these depth jumps from height.
Right.
And they find that the more powerful ones will actually load into the knees, and then they're up faster than the ones that load into the hips. But the ones that load into the knees actually experience more injury over the course of their career. So it's better too load into the hips, especially if you're an NBA athlete that's jumping a lot. That's a lot of repetitive force, but it's also something that we would want to see in here as well, because our number one job is to reduce injury. So if you're a golfer that's looking to gain some of that speed, we want to make sure that we're loading into the hips, then the knees, then the ankles, because that has been shown to decrease the risk of injury over time. And also something that we're looking at the studio is with BodyTrack. We're doing vertical jump testing. We're seeing how much force you can apply into the ground compared to body weight, and how fast do you do that. So obviously, the higher force, the better, and the less amount of time, the better.
Right. Frequency. So back when I was in the exercise science program, I'm still in the program, but my junior year when I was in the program, we were able to conduct fitness assessments on each of our clients. So we would take them through a Fit VP. We would measure frequency, intensity, time, type, volume, progression. So these are basically the variables that I've used here, not in that order. But that's typically how you would decide what exercises were best for your clients to do. So frequency, if we were doing resistance training, it would be about 2 days a week. But in case of plyometrics, 2 to 3 days a week is okay. So this is why we suggest, if you're doing our strength class, that's resistance training, do that 2 times a week. If you're doing plyometrics, do that 2 to 3 times a week. Whereas our function class is flexibility. So flexibility, you can do that 5 days a week if you want. So that's why you're okay to do function 5 days a week with us. But the most important point in all of frequency, in all of working out, is that your body is able to recover. So, like I said, the function is fine 5 days a week, but if you're doing the strength and if you're doing the perform, then your body needs that 48 to 72 hours of recovery in between sessions in order to rebuild those muscle fibers and, get the body ready to perform again.
Right. And I think one of the most common questions is, how do I know I'm recovered? So one of the products that's out now is this Whoop band, WHOOP. It was something that Rory McIlroy wore in the playoffs last year. It was gotten really popular with golf as a result of that. But what they are measuring there is heart rate variability. So they're looking at how much variance is there beat to beat in the heart, and that's been shown to be a very accurate way to measure recovery. But another way is to count resting heart rate. First thing in the morning, you can get up, measure your resting heart rate, and this would be on, say, the weekend when you haven't trained. You want to get a baseline. So if you've done a couple of really hard training sessions over the course of the week, and you notice that the next day, maybe I'm 5 to 7 beats higher than I was yesterday, then you're not fully recovered yet. So this is where we want that 48 to 72 hours of recovery in between sessions. It's really important to get that, but that's an easy way to tell whether you're recovered or not.
So this just goes back to the recovery, but we're splitting it up in between specific exercises. So depending upon the type of exercise performed, determines the amount, depending upon the type of exercise and the level of intensity of that exercise is going to determine how much recovery we need. So if we're doing our depth jumps between reps, maybe 5-10 seconds, in our perform class, we don't usually do that just because we are doing a circuit-based training. We're doing really fast movements. In our strength, we tend to give it about 2 to 3 seconds in between each one. And then between sets, you're supposed to give yourself about 2 to 3 minutes. But then for our power clean, so like today, we did a lot of extension, some catches, and then push press. So since we're doing it with lightweight, since we're doing it with a golf club or an umbrella, these rules don't necessarily apply. But if you have weight, if you have a barbell with 75 pounds, 90 pounds, like some big power lifters do, then between reps, you're going for max reps. You're going for 3 full all-out reps. So you want to give yourself 1 to 2 minutes between each rep, 5 to 7 minutes between each set. But once again, the primary point here is you've got to do 48 to 72 hours between each session of training.
Yeah, right. So if you're just using a golf club to press overhead, these rules definitely don't apply compared to pushing over 100 pounds with a barbell overhead, or whatever your capacity is.
So for volume, typically if we were to go for resistance training, it would be sets and reps. That would be how we would define volume. But in a plyometric exercise, it's going to be based on the number of contacts or the number of throws. So if we're thinking lower body, the other day, Darren had us do switch feet. So we were switching our feet back and forth from our box jump. So that would be an example of a lower body plyometric exercise. And we could measure that based upon the number of foot contacts, the number of times that we're touching that box. If we're doing upper body, and the other day we were doing throws, so it would be the number of throws if you have a tennis ball, if you have a football. If you're a beginner athlete, it's typically between 80 to 100 contacts. That's 80 to 100 sets, not on either foot altogether. So that would be 40 to 50 on each side. If we're an intermediate athlete, we're doing 100 to 120, and if we're advanced, we're doing 120 to 140. Once again, that's all together. So that'd be 60 or 50 to 60 on one foot, 60 to 70 on the other foot. So progression is dependent upon the sport, the training phase, and design of the strength and conditioning phase. So depending on the sport, if we're doing golf, if we're doing basketball, if we're doing soccer, the training phase gets a little bit more into periodization. So if we split it, just as an overview, if we split periodization down, each sport can be split up into you're either in season, off season, we're in preseason or postseason. So depending upon the phase, usually as we get closer to in season, we get more sport specific in movement. So we're doing movements that are focused on that sport, that do create movement. So if I'm in golf, I'm focusing on rotation. If I'm in basketball, I'm focusing on vertical power. If I'm in baseball, focusing on that rotation. So as we increase this intensity, we're going to decrease the volume. So once we get closer to sports season, then we need to be at our best, our most maximal sport-specific movement. So we're going to increase our level of intensity, but we might not do as many sets and reps. So this is the reason why in our perform phase, we might do lower number of repetitions, because our level of intensity is much greater. We're not taking as much rest. We're doing more higher intensity exercises. So our master's athletes is how the CSCS defines. These are typically athletes over the ages of 65. So when we meet with these athletes, we really focus on understanding what their goals are in our program. Do they want to lose weight? Do they want to increase strength? What are we talking here? How do they want to improve their level of ability? And then we need to consider their medical history. Have they had a hip replacement? Have they had a shoulder replacement? Do they have diabetes? Do they have low blood pressure? Do they have high blood pressure? So we're really looking at every single form of medical history that we have available to us. And then in most cases, we're able to use the same guidelines as adult athletes. We might have 5 low to moderate intensity exercises. We're going to have lower volume, so we might not have that 80 to 100 foot contacts. We might go 50 to 70. And our recovery time may be increased, so we might only work out with them Mondays and Fridays or Tuesdays and Saturdays. And then we need to determine at the end, is the athlete experiencing soreness or pain, or there's a difference. Soreness is okay. Muscle soreness, I worked out, my muscles are tired. Pain is bad. We don't want any pain at all. So being able to differentiate what exactly is going on with our athletes is our number one important.
Yeah, and I would say that this phase is really the biggest differentiator from program to program, because this is something that a lot of our players might not even get into, just because they're going to have much more success trying to get out of those painful movement patterns. And if we're trying to layer on speed when they have pain, then we're just going to cause issues. So it's important to analyze, okay, is this something that I could handle? And it's really on us as coaches to communicate that as well, to say, hey, this would be something that you would be ready for if your goals are aspiring to that level. This is where we could see some further increases with training. So kind of consider this as the upper echelon of what we're doing as coaches. But our number one goal is not to create pain. Excellent. Thank you for taking this. through all of the information. It was very helpful. I think that's something that people are hesitant to get into just because they don't know a lot about it. They don't know how much should I be doing, and then they go and they overdo it and they run into issues right away, which is really the issue. So they're doing it out of a place that's too intense for them, and we need to know how to progress it appropriately. So this is a great reference to how you can do that.
I think the number one importance is knowing your trainer and trusting your trainer, that they're gonna get you through, that they're going to put you in the right direction. Make sure your trainer's certified and make sure that they understand, okay, I can't push this individual as much as I could, maybe a younger athlete or a more experienced athlete. So make sure your trainer gets to know you, understands who you are, and just takes an interest in you every hour. If that's your hour, it should be focused on you, your goals, and what your plan is. So. And recovery, make sure you recover 48 to 72 hours.
Absolutely. Well, thank you very much, Elsa, and I'm sure we'll be doing this again soon.